Welcome to my channel Lenovate. In this video, we will going to discuss about the anatomy of thyroid and parathyroid gland. So in this diagram, here we can see that this is a shown anatomy of a thyroid gland, and this is the anterior view of the thyroid gland. The thyroid gland that is present in anterior part of the neck, and it is anterior lateral to the thyroid cartilage, the cricoid cartilage, and the tracheal rings. So this whole is the thyroid gland that is divided into two lateral lobes. This is the one lobe of thyroid gland and this is the second lobe of thyroid gland. These two lateral lobes of thyroid gland are connected with each other by a narrow isthmus. And this isthmus is present anterior to the second and third tracheal ring. Now here you can see this is a lobe called as a pyramidal lobe. And this pyramidal lobe is the caudal end of the thyroglossal duct that is attaching it to the hyoid bone. So this is a remnant of a thyroglossal duct that may persist in some of the thyroid glands. Now coming to the shape of thyroid gland, that is a pyramidal shaped thyroid gland is present anteriorly in the neck, and it is posterior to the sternohyoid, sternothyroid and omohyoid muscles. This whole gland is located in the visceral compartment of the neck, and it is covered by a layer of pretracheal layer of deep cervical fascia. Now coming to the blood supply, nerve supply and venous drainage. But before discussing the nerve and the vasculature, we will going to discuss the another gland that is related with the thyroid gland is the parathyroid gland. Now here in the posterior view of this same thyroid gland, we can see that it is related with the pharynx, and this is the esophagus going on posteriorly in the neck. And the two sides of the esophagus is covered by the lobes of the thyroid gland. The isthmus is present anteriorly. So posteriorly you can see only the two lateral lobes of thyroid gland. But here one important thing, see that these are the two pairs of the parathyroid glands. And these parathyroid glands, that are two superior parathyroid gland and two inferior parathyroid gland, are the small ovoid yellowish structures present deep surface of the lobes of thyroid gland. They are located in the bifurcation of the inferior thyroid artery. 1 cm superior to inferior thyroid artery is a superior parathyroid gland, while 1 cm inferior to inferior thyroid artery, this is a inferior parathyroid gland. The function of parathyroid gland is to release the parathyroid hormone, and the anatomy is shown in this diagram that they are located in the posterior surface of the lobes of the thyroid gland, and they having their blood supply from the inferior thyroid artery. Now coming to the vasculature of both the thyroid and the parathyroid gland. Now in this diagram, here we can see that this is shown the vasculature of thyroid gland. In the anterior view of thyroid gland, we can see that thyroid gland is supplied from the two arteries, that is the superior and the inferior thyroid artery. The superior thyroid artery is a branch of the external carotid artery. This is the external carotid artery going on and releasing its branch, the superior thyroid artery, that passes and supplies the superior and the anterior aspect of the thyroid gland. While the inferior thyroid artery, that inferior thyroid artery is a branch of the thyroglossal trunk. This thiocervical trunk goes and upward and gives its branch, that is the inferior thyroid artery, and that inferior thyroid artery will going to supply the inferior surface of thyroid gland with the posterior surface of thyroid gland. On the posterior surface of thyroid gland, this inferior thyroid artery will going to supply the parathyroid glands as well. So this was the arterial supply of the thyroid gland. Coming to the venous drainage of the thyroid gland is from the superior thyroid artery that is running along with the superior thyroid vein that is running along with the superior thyroid artery. The middle part or the isthmus is supplied from the middle thyroid vein, while the inferior part is supplied through the inferior thyroid vein. So here again, the superior and the middle thyroid vein primarily drain into the internal jugular vein. This one is the internal jugular vein that having its drainage from the superior thyroid vein and the middle thyroid vein. While the inferior thyroid vein have its venous drainage and ultimately drain into the brachiocephalic vein that ultimately drain into subclavian. So this brachiocephalic vein got its venous drainage from the inferior thyroid vein. So this is a venous drainage of the thyroid gland. Similarly, the parathyroid gland having its arterial supply from the inferior thyroid artery coming from the thiocervical trunk, while it having the venous drainage from the similar inferior thyroid vein. While the arterial supply and other venous drainage and lymphatic drainage is similar to the thyroid gland. So this was all about the anatomy and the neurovasculature of thyroid and parathyroid gland. I hope you will explain well. Thank you for watching. Subscribe for more. Don't forget to like, share and subscribe. Thank you for watching.